Hi, good morning, everyone. I'm Dr. Celine Gander. Welcome to this session on science communication. We're going to kick off the session with the five of us panelists talking a little bit about our own stories, who we are, how we got into science communication, and what we're doing with science communication now. And then we're going to be splitting up into smaller groups. Each of the panelists will be leading one breakout group where those of you in those sessions will pitch a story, whether it's a story for print, written journalism, local television, or larger television outlet, radio or podcasting, whatever outlet. This is really more of an exercise to get you thinking and to practice what it might look like to reach out to a media outlet about a story you would like to cover because it's something that you're passionate about, you want to advocate about, you think that there's something really important for people to hear about. So let's just go ahead and dive into introductions to make sure we have enough time for those breakout sessions. I'll get us started. So I'm Dr. Celine Gander. I'm an infectious disease specialist and epidemiologist. I got my start in science communication back in the 1990s. My first job out of college was working as a tuberculosis advocate. At the time, there was a lot of attention around HIV and HIV advocacy, but not around the two other big infectious diseases, tuberculosis and malaria. And so that's really when I learned the importance of science communication for helping translate science into policy and impact. And over the years later, as I went on to medical and public health training, spent a lot of that time working in sub-Saharan Africa, would get asked to help host town halls, meetings with journalists and advocates locally, meetings with local officials about the latest science and what that meant for their policies, programs, and practice on the ground. And back in DC, would get asked to help with the Infectious Disease Society of America's outreach to Capitol Hill. So that would mean things like meeting with congressmen and senators in Washington, DC, really just reflecting on what I was observing on the ground and why they should care about global health and other infectious disease issues. More recently, during the Ebola epidemic and now the COVID pandemic, have been very active writing on television and also in podcast and radio, speaking about these various different issues. So I'm going to turn it now to my colleague, Mati. Oh, shoot, now, Mati, I was going to say it correctly. Now I'm going to fumble it. Shwayo Davis, who is in St. Louis, Missouri, but is originally from Zimbabwe, right, Mati? Zimbabwe or Zambia?
That's right, Zimbabwe, yeah.
Zimbabwe, that's what I thought.
Yeah.
She's going to tell you a little bit about her own life journey and how she got into science communication as well.
Thanks so much, Celine. And it's such a pleasure to be here and to be able to share our stories. These women on this panel are actually heroes of mine because my passion for science communication is embedded in my science for all things infectious diseases and specifically community engagement. So I'm originally from Harare in Zimbabwe, born and raised, did my training here in the US, and am both an infectious diseases physician and public health expert, and really found myself pivoting to this in a very real way at the beginning of the pandemic last year. Found myself 7 months pregnant, an infectious disease doc right at the beginning of the pandemic, and also being bombarded by statistics about how I, as a Black woman, was 3 times more likely to die than my white counterparts. 2 weeks after my child was born, George Floyd was murdered. And a switch went off for me, as it did for many Black men and women across the country, about how we can be the change for our communities. And for me, that meant really centering myself and removing the imposter syndrome that exists for a lot of women in academic medicine that makes us believe that we do not have a seat at the table when it comes to science communication. I would always punt to the old white guy in the division, the old white guy that leads, right, as the expert, and would always turn down local and national news requests. Well, after that happened, after that switch went off, after I found myself breastfeeding in the middle of the night, watching the George Floyd video, seeing the disproportionate impact that COVID was having on my community, I decided I wasn't punting anymore. And it started as a slow swell locally here in St. Louis, and then built and built and built. But it was also the advocacy of groups like Centrovox who advocate for diversity in science communications and really took me on and would pitch me to other outlets, both locally and nationally. And then, I always thought I would come on with a print and one too many afros and a little too much saying racism on national and international platforms, and they'd never have me back. But the rest is history, and here I am. And this is honestly this community that also now extended to social media platforms, because if you're going to be serious about community engagement and meeting people where they are, that means meeting people where they are. And even though I'm the auntie of social media and I'm not as witty as some of my counterparts here, I had to figure it out and make sure that I was able to reach my community on all these platforms. So really excited to be here and to hear from these other women that really have inspired me.
Next, Syra Madad, my colleague here in New York City.
Thank you so much, Dr. Gounder. It's a pleasure to be here with you all. So I'm Syra Madad. I serve as a senior director at New York City Health and Hospital System-wide Special Pathogens Program. And my footing into science communication actually started when I started teaching over a decade ago to students in undergrad and graduate level programs in topics and subjects in public health, from biology 101 to microbiology to many different types of topics in that particular realm. And I emphasize the need for science communication because I think early on we knew that we need to build this into the curriculum of our emerging leaders, of our next generation, because this is a topic that is near and dear to my heart. And having responded to multiple different outbreaks from measles, Zika, so many others, we have seen that anytime you have this type of event, you're combating the contagion, and then you're also combating the contagion of misinformation. And so really important to do good science and risk communication at the same time, not as an afterthought. And so initially it was a lot of trying to teach students the curriculum of science communication and how to do it efficiently and effectively. And now in my current role within New York City, I play a couple of different hats. So first, within the healthcare system, I lead the COVID-19 vaccines communications and outreach work group. And what we do is we produce a lot of resources, educational material, both for our own staff, because it's important that we educate healthcare workers on good science communication, but also for our patient population, and then generally for the general public. So give them really good science and evidence-based information in a way that they can understand. And then I also run a COVID-19 science communication series at Harvard University's Belfer Center, because I think many of us do see the need to ensure that the public obviously understands what's happening. And to give you an example, this is one thing that we hear from patients and just generally your community members all the time. You put on the nightly news and all you're hearing are these numbers thrown at you, 94%, 95%, 75%. What do those numbers mean? Really hard for the general public to understand, to put that into context and what this means to them and the risk to them, and what they can do to help, prevent, whether it's an infection or, preventing, contributing to the ongoing cases of COVID-19 as an example. And so emphasizing good science and risk communication has been really, really important. And the last thing that I'll mention is, as we are in this particular field, it's been never more important to highlight it and to have more people like you all be part of this. Because when we look at just in the current pandemic that we're in, bad information is causing, three things in particular. First, it matters where you're getting information from. So making sure that we educate people on what reliable and credible sources are. Second, making sure that people understand that by getting good information, it's helping them. And by getting bad information, it's actually putting them at more risk. And then third, it makes combating, whether it's this pandemic or any health threat, that much harder. So really important that we try to build a generation of good science communicators that can help us, in the next issue that we're going to be dealing with.
Thank you, Syra. And next we're going to hear from Ebony Hilton at the University of Virginia.
Yeah, I'm also a fangirl, and like Dr. Davis stated, I always have the saying that women, we birth nations, so of course we can run one. And so I'm super excited to be surrounded by women, because truly we have the life lived experience of what it feels like to be a minority in many different, I know we have people joining from all over the world. And unfortunately in society, women are oftentimes not valued for our voice or our ideas. And because of that, we've learned how to navigate a system that wasn't necessarily created for us, and yet we strengthen it every time we do open our voices. And so one of the things with this pandemic, I came from a single parent home, and my introduction to medicine was literally my mom telling us when I was 8 years old about how her first child was born prematurely at 6 months, lived for 3 days, and died. My brother would have been 43 years old this year. And in growing up in medicine, my initial thoughts were kind of altruistic. I wanted to help people not have that same lived life experience. But as I can admit, growing up, I also became increasingly more selfish in thinking, I also don't want to experience that same disparity in my own life. And what we realized is that these disparities, healthcare disparities, lie heavily along the lines of race. And if you're thinking about the intersectionality of race and gender, that's a whole nother level that we're dealing with, not only in the United States, but across the world, of where minority women, we are more likely to have worse outcomes. And even, for instance, with this pandemic, white men, Black women were 3 times more likely to die than white men. Although the news media keeps on saying that being a woman is protective, it's not protective for us. And so what I heavily concentrate on is what causes those differences. It's not that we're innately different. It's not like we're genetically different. But what is the intersection of poverty and privilege? What is the intersection of politics in this and policy in this pandemic? And how do we truly uncover, when we're looking at health disparities, racial injustice and entitlement and privilege, how both these things are now proven to be deadly in their own way? How do we address the root cause of what centers in that disease process as far as systemic racism, and speak on that unapologetically so we can change outcomes for generations to come?
And finally, not last but not least, my dear friend Stella Sapph, who is also here in New York City.
Hi, everyone. It's such a pleasure to be here today with these amazing, amazing women. I want to echo what everyone has said, which is that the urgency of now forces us to have to use our voices. I really resonate with the comments earlier about how, so often we're not the ones who are asked to speak up, and yet we have so much to say. And I think what this pandemic really did, the kind of dual pandemics, the continuing pandemic of racism in the United States, was push many of us out of our comfort zone and push many of us past the kind of stated barriers. So for those who may practice in the US, one of the barriers, if you're in an academic health system, is they tell you that you cannot speak to the media or to any outside sources without going through your communications office. And then they make that process really difficult. Well, I think for me, one of the really nice things that was very freeing was early on knowing that if I wasn't speaking, that there was, at least in some of these contexts, there was a lack of information going out. And so it allowed me to be bold. And once I took that first step, the rest followed from there. I want to kind of address a common misconception that I think some people have when they see people like us up here, which is that they believe that the only way to kind of have your voice heard is to be on CNN. We can't all be like the amazing Dr. Gounder and Dr. Hilton. Like it isn't in some ways the prototype that I hope people keep in mind, right? For me, my kind of walk into this is I trained in internal medicine and HIV care, and primary care is my passion. And in primary care, the thing that always really bothered me is that people would come in who had had chronic conditions for years. People who had had diabetes for years. I'd be talking to them about their diabetes management, and it was so clear that they had no basic understanding of their disease. Same thing with HIV. You'd mention things about their immune system and they'd say, what? And they have had HIV and been treated for it for years. So for me, my kind of background in science communication, even with an MPH, really started with my patients, sitting in their rooms with them, explaining to them what they had in language that they could understand, and then listening to them as they expressed back what they understood of what I said. And for me, that allowed, I think, a real sense of the importance of the simplicity of how you communicate. I love to talk. But more than that, I love when people understand something about themselves that allows them to promote and take care of their health. And so it wasn't a hard transition then to take that background and really translate it into more kind of public, media facing fora where, we would speak on either podcasts or print media or television. And I think that the understanding that you are doing it from a place of helping patients to maintain their health takes away some of the fear, some of the resistance, and some of the reluctance that you may not have something to say. And I really want to encourage people to kind of start from that place of your communication could be the difference between someone knowing how to take care of themselves and feeling confident in, let's say, getting the vaccine or not. I also want to kind of emphasize the importance of thinking about how we advocate, not just around the science of medicine, but also the social determinants of medicine. And I think many of us have really used the opportunities we have, yes, to talk about COVID transmission rates and talk about everything that's happening with the pandemic, but also the structural issues that many people often don't want to hear about. And to me, that kind of piggybacking is the reason why it's important that you have folks from different groups, women, minoritized populations in these spaces, because we bring a message oftentimes that would be left, usually unsaid. And so again, I just want to encourage everyone to really get on this journey yourself, because more voices like ours are needed.
Thank you, Stella, and a really impressive group of ladies we have with us today. So very excited about what comes next. One thing that I think might help frame the breakout discussions, here's how I think a little bit about different media platforms. And I think what you need to decide first is, what is the message you want to get across and to what audience? And different media platforms are really good at communicating certain messages to certain people. You're not going to be able to reach everyone, especially in this day and age, through any one platform. So if you look at the demographics, for example, of who watches cable TV news, so CNN, which is, I do a lot of MSNBC, which Ebony is also on a lot. That's largely an old white demographic. If you're trying to reach younger, more diverse audiences, that might mean, for example, getting on certain podcasts. When I was in Guinea for the Ebola epidemic, I did a lot of local call-in radio shows in French, since I speak French. It could mean community school board meeting, any number of things, depending on who it is you're trying to reach with what message. So some just brief instructions, and I'm just going to pull up my notes so I don't forget what I was going to say here. It's not here. What we want you to do is think about, what is the message you're trying to get across? Who is it you're trying to get that across to? Why are you the person to be delivering that message? And then very briefly, what is that message? What is the story you're trying to tell here? And each of us in our separate groups will be listening to these pitches. It's really an exercise to get you thinking about how you can do this yourself. And we'll provide you with some feedback about how to strengthen how you package yourself as you do this kind of outreach. I think particularly for many of you, local radio might be the easiest place to get your foothold, but there are a lot of different ways to do this. Again, writing, television, radio, podcasting, and just in-person local venues. So I'm going to turn it to our organizers to get us split up into those breakout groups now. So I'm told they're working on getting us split out. So just be patient while they set up the tech for us.
In the interim, can people put in their chat where they're all from?
Oh, the participants in the group. Yeah, while we're waiting, if you could just drop a note in the chat and just let us know where you're from.
And while we're doing that, one other thing to add is the importance of being pithy and short. I feel like that's like a common mistake that many of us make, and that we think we have a really interesting thing. And so we go on. And a lot of these producers are just like, what is the sound bite? So try as much as you can to think, about how to shorten and tighten what you want to say, because oftentimes that'll be the thing that kind of gets you in.
Yep. It's a great point, Stella.
I guess we can share some of our tips in the meantime. Oh, we got it.